I'm just going to give it a minute or two more. Give everybody a chance to join. Okay, I think we should get started. It's a little after 10. Welcome, everyone. Thank you for joining us for session 5 of Indiana 211 University. As a reminder, recordings of all of our previous sessions can be found on our website at in211.org. My name is Jill Shimon, and I am a Community Engagement Coordinator for Indiana 211. Before we begin, we would love to hear your feedback on today's session through our survey. You can access the survey through the QR code on the screen or by using the link that Sherry will put in the chat here in a moment. I do suggest opening that link at some point during the session so that you don't lose that link before the session ends. And as a reminder, if you plan to use today's session towards continuing education credits, then you need to you would need to complete the survey in order to ensure that we have you noted as having attended the live session. With October or November being with November being Veterans Day, we wanted to have our presenters from the Indiana Department of Veterans Affairs um, present to you. And so our guest speakers today are Brian Schmidt and Obadiah Smith. A little background, Brian is a Marine Corps veteran. He enlisted while in high school, then served as a member of the security forces in Southwest Asia and as an infantry squad leader. Over the course of his enlistment, Brian deployed to over a dozen countries. Upon returning to Indiana, Brian attended Ball State University and started getting involved in the community, once deciding to work on veterans initiatives full-time. Brian has held positions such as a county veterans service officer, a district service officer, and finally the health and wellness director at the Indiana Department of Veterans Affairs, focusing on suicide prevention. Obadiah Smith Jr. is a retired Lieutenant Colonel Air Force chaplain who served 20 years within the Air Mobility Command. He received a Bachelor's of Arts degree in sociology from Azusa Pacific University, a Master of Divinity from Fuller Theological Seminary, an MBA from Anderson University, and a military equivalent master's degree. He completed a 4-year doctoral program at Anderson University School of Theology. He is currently the Veteran Suicide Prevention Director for Indiana Governor's Challenge. Welcome, gentlemen, and thank you so much for being here. I just wanted to recap real quickly what the Indiana Department of Veterans Affairs is. Indiana Department of Veterans Affairs missions is to support, serve, and advocate for the Indiana veteran community. This Indiana veteran community consists of veterans, family members, caregivers, friends, organizations, and providers that touch veteran lives in some way. Indiana owes a great debt to its veterans, past and present, for their personal sacrifices and dedicated service. IDVA is committed to providing quality services, benefits, and programming, and are devoted to enhancing and expanding Indiana's resources, continuing our vision. And so with that, I would like to introduce Brian to begin our session.
Yeah, thank you so much, and I'm happy to be here with you all today. And I wanted to first off thank you all for the work that you're doing, connecting individuals with disabilities to resources in their community as well. And hopefully some of the content we're going to speak about today is quite relevant to the work that you do. One of the things in my work I encounter is many veterans. Most all of them have some level of a service-connected disability. So veterans, community members, veterans, I know always struggle to find certain resources, especially the ones that are most relevant to them. So hopefully you'll find some, tidbits in here to help you kind of look at through your job in a little bit of a different lens, maybe when you're engaging some of the veterans and some benefits that might be relevant to them. So I might be a little bit all over the place here because I'm also trying to find some things that are also, again, relevant to the work that you're doing on the day to day. And first off, you'll notice here you're not seeing the IDVA logo. It's Join In logo. And that's a logo that we created because, it's not about us at IDVA or our partners at FSSA or Department of Health or the Indiana Guard. Everybody can play a part in impacting veterans' lives regarding suicide. So what we ask communities is, what do you do? Where do you do it? And how can you join in? And when you look at the Indiana veteran community, so when you think of it, I'm a veteran. Some of us are related to veterans. You're the neighbor of a veteran. You have a family member that's a veteran. So we're all really involved in the Indiana service members, veterans, and family member and caregiver community. And so that's really where the kind of gist of our program lies. And just to give you an idea about the governor's challenge, it's not really the Indiana governor's challenge. This is a national challenge to governors and mayors across the country to do something different, innovative to address veteran suicide in their community. As you can imagine, the way that you're going to address veteran suicide in California is going to look completely different than it would in Indiana. And then when you look at Indiana, the way that you're going to address veteran suicide in Lake County is going to look completely different than it would in Grant County. So our program here is about what we have developed in Indiana that we're here to roll out. And so just to give you an idea about how our program came about. So the Governor's Challenge has been around for some time now. And typically it's housed in the Family and Social Services Administration because they're doing suicide prevention work. But when our director, found out about this opportunity, he's like, no, I want to house this here in our agency. Not that the other agencies aren't doing great work, but we wanted to have that constant veteran focus. Just to give you an idea, roughly 40% of veterans that die by suicide are not connected to the federal VA. They're not receiving health care benefits or connected to those veteran-specific resources. Who are they? They're just people out there doing people stuff, so that they might not take advantage of these resources for a number of reasons, maybe because they don't feel that they're a veteran, because, maybe personally they feel they're not because they didn't deploy into a combat zone. Or maybe it's a spouse that, a couple that was in the military and then maybe the spouse got pregnant, got out, discontinued their service, and they don't consider themselves a veteran because their husband did 8 to 12 years why they got out because they were raising a family. That individual's eligible for benefits. So and especially here in Indiana, we have the 5th largest Indiana Guard population in the entire country. Guardsmen are not considered veterans upon being out, federally considered that, unless they've had 180 days of active duty service. So Indiana's veteran population is quite unique in that regard. So the way that we go about this is a framework of, identifying veterans through, not just asking if someone's a veteran, but are you a veteran? Have you served? Has a family member served? So one of the main pillars of our focus is to identify that service member and veteran community. And so when we developed our framework here in Indiana, we really thought like, okay, who are our partners that are going to help us develop this plan? And so we thought about, okay, what state agencies are engaging veterans? We have the Department of Correction, unfortunately, Department of Health, FSSA, the Indiana National Guard, the Bureau of Motor Vehicles, Department of Natural Resources, Indiana State Police. So we thought about all of these different individuals and some other partners outside of state agencies, and we brought them collectively in here together and asked them to be a part of this mission to help us create a plan to address veteran suicide in our community. And with that said, we put, and I'll ask you to change to the next slide, please. So what you'll see here is our kind of core team here. So once we developed this plan, we brought this to the governor's desk, we were able to obtain funding to support this mission. We received funding to support 4 new positions that you see on there. So we have Brad Harper with us here at IDVA. He's really focusing on that upstream suicide prevention. So when you think about suicide, let's say it takes 6 factors for someone to complete a suicide. The upstream prevention is really meeting them at like 2, 3, or 4, that kind of peer-to-peer, that networking, that kind of vet-to-vet aspect. Secondly, you'll see Leslie Evans on there with us. She's our program administrators. You'll hear me talk here shortly about some of the work we're doing with community coalitions throughout the state. So she's really kind of the, we call her the chaos coordinator. She's really the one maintaining communications with all those coalitions, all of our partners, and our QR code that we utilize to identify veterans that we'll speak about here shortly. And then secondly, you see Obadiah Smith, which will be on here shortly. He's really focusing on that moment of crisis with that veteran. So he's our suicide intervention director there with Michelle Bullington at DMHA. And then finally, we have Carly Gibson with us, and she's really focusing on that post-vention development of lost teens and suicide mortality review. And she's under Morgan Sprecher there at the Department of Health. So we thought that was quite unique. So the funding we received to support these positions, IDVA actually funds those positions in those other agencies. And the reason is because we always want to ensure that we have that constant veteran focus in the work that they're doing and the great work that they're doing in and around suicide prevention and suicide fatality review. And then also you see there on the bottom, we have the Indiana National Guard, the federal VA, who's been very instrumental in this process with us. And then the Purdue's Military Family Research Institute that's really there assisting us and supporting us with a lot of the data that we're utilizing to kind of justify where we're going, why we're going, and also measure the results of the work that we're doing in and around communities. And so next slide, please. So what you're seeing here, the community coalition rollout, is like, what is this? When we look at Indiana, we looked at Indiana as, 92 counties with 92 personalities that don't necessarily want the state or federal government coming in there telling them what to do or how to do it. So we really were thoughtful in this process because the suicide prevention efforts really need to be led locally. But the trips that we had made back and forth to DC to meet with the federal VA and with SAMHSA to understand what are all the other states doing. So we went out back and forth probably about 5 or 6 times and met with every other state and every territory as well to understand where they're at in their governor's challenge process, meeting with them to share their best practices, to what works, what doesn't work, and then bring that to the communities. And so when we worked with the communities, we really want to introduce them to this governor's challenge because, as I'm sure many of you are well aware, community coalitions come in all different strengths and sizes. They're probably led by 2 or 3 people that are really running the show, and that it's not their full-time jobs either, but we need their input in this work. So we really want to introduce them a plan and really show them that this is all about partnership and teamwork. And then we wanted to really inspire them with some different ideas on how they want to work towards identifying their SMVF community and promote connectedness, improve care transition, lethal means safety and education. We want to help them interpret the data that we're bringing to them from Purdue's Military Family Research Institute, be able to be nimble and assess progress and changes and to adapt and react to some of that measuring. And then we want to invest in them, which I'll speak a bit about here in a little bit, with the opportunity to have a planning grant and work with a strategic planner to develop their own 1 and 2 year plan, and then to be able to actually fund that plan and implement that throughout the upcoming years going forward. And if I could go to the next slide, please. So this is an example of some of the data that we're bringing into communities. And what you'll see here is this is actually Wayne County, so over there in Richmond. And so we're providing them with and this is all publicly available data that Purdue's Military Family Research Institute has sourced. And so we were providing them with their veteran population. And has that veteran population increased year on year? What percentage of their overall population is veteran? You know, so as you can see with Richmond, that's about 9% that's a veteran. So, and it has the number of children in the household that are veteran children. And what's that veteran age distribution by gender? And then also by age ranges, 18 to 34 and 35 to 54 and so on. And then we're also breaking that down a step further with the veterans' race and ethnicity distribution, their military population, active duty, guard and reserve, military dependents, and then finally, what's their community look like? We're giving them that the veteran median household income, what their 3-year average community suicide rate is, and the rural urban continuum. You know, and this is some of that information that can really help them get to know their community a little bit better and create different pathways to engage different types of veterans, because we all have different interests. You know, I wish that all veterans were running around and still joining the American Legion or the VFW. That's not the case anymore. We can identify the veterans that are, you know, wearing the hat and wearing the jacket, and you see them at veterans events. But yeah, as I mentioned earlier, the 40% of veterans that die by suicide aren't connected to any of the federal VA benefits, resources, services. They're just people out there doing people stuff. And just to give you an idea, 40% of veterans are eligible for some type of benefit, and only half of those veterans are accessing them. So you got to think of, I think there's a total veteran population in Indiana of about 35,000, or maybe it's 135. I should know my stats a little bit better, but I apologize for that. But so let's just think of this number: 20% of Indiana veterans are accessing the services when 40% of them are actually eligible for some type of benefit. And these benefits range in everywhere from, just to give you an idea, here in Indiana, a state benefit is if a veteran has a service-connected disability rating of 10%, the most commonly VA approved rating at 10% is tinnitus, a ringing in your ears. That veteran will now qualify for a $24,960 property tax deduction on their home.
Wow.
That veteran will also qualify for tuition and fee exemption for all of their children. So if that veteran discharged the military after 1990, has at least a 10% service-connected disability rating, and has lived in Indiana for a total of 5 years, not even cumulatively, just 5 years, all their children will go to any state university tuition and fee exempt. That is a massive benefit. And then not to mention the VA healthcare. You know, a lot of veterans are able to obtain healthcare out in the community, but the VA provides great care, and they have a lot of the community-based outreach clinics. So that's an aspect of it. So we're really working to identify all these veterans so we can get them connected to all these benefits, resources, services, obtain these service-connected disability ratings that they may be eligible for, and then ultimately connect them to all the other services that are out there. And if I could go to the next slide, please. So you're probably wondering, like, well, I want this to come to my community. Well, we could possibly make it to all 92 counties or communities at one time. We have to be able to kind of justify where we're going, why we're going. So as I've mentioned, we have been working with Purdue's Military Family Research Institute. So they have taken this again, publicly available data, and we've developed this community risk index of these 10 factors. Now, there's many more factors that may lead to suicide ideation, but these 10 factors are equally measurable across all counties in Indiana. So those factors that we have broken down, are firearm sales locations, social associations, education level, the digital divide, long-term care capacity, access to mental health care providers, poor mental health days, overdose incidents, survivors of suicide, and poverty rate. So what Peru has done is they've taken that, and then we have to weigh that against our community population data. So we score this from 1 to 5, 5 being the most at risk. And so we've taken the active duty veteran population, reserve population, veteran population, the total military and veteran, total population over 18, and military and veteran density. And what Purdue did is they mashed all these numbers together, and it basically just sped out all 92 counties in order of 1 being the most at risk down to 20. And so then we got to be like, okay, well, we want to start with number 1, but we want to understand where those communities are at. So we work hand in glove with our federal VA counterparts out of the VHA, Veteran Health Administration. They have, VA used to be very kind of internally focused. In the past several years, they've been very externally focused. These positions are called the Community Engagement Partnership Coordinator. The Rowdebush VA downtown Indianapolis has 2 of these positions. There's Jesse Brown out of Chicago that has 1 of these positions that covers about 5 or 6 counties in the Northwest. There's Northern VA out of Marion, Indiana. And then there's the Dayton, Ohio, Cincinnati, Ohio, Louisville, Evansville, and then 1 more on the eastern border outside of Terre Haute in Vermilion County, or north of Vigo outside of Vermilion County. So Indiana is quite unique as there's 5 or 6 different VA hospitals that have coverage in Indiana that our veterans attend. So these positions are working in every single county, and what they're doing is they're working to identify existing community coalitions. They're not trying to reinvent the wheel. They want to find a community coalition that just exists, and then bring a suicide prevention focus to that coalition if that's not already a focus, and then bring a veteran focus, and then ultimately a veteran suicide prevention focus within that community. And so what we want to understand from that community is, who is this coalition? Do they meet regularly? Do they have established leadership? Are they a nonprofit? Do they have a fiduciary agent where they can receive granted dollars? And then we actually also have a what's called as a community coalition checklist that lets us. We want to know who's at the table, so we want to understand where their strengths are. So is someone from law enforcement a part of the coalition? Public education, county coroner, city council, K through 12, county veteran service officer, someone from the health department, et cetera, et cetera. So we can really understand what their strengths are, but maybe some of the opportunities to bring in some new members into their coalition. So we could really, when we develop this suicide prevention plan and implement this plan, all the right voices at the table to help give this kind of the best direction that we'd like to fund. And so that really kind of gives us our direction of, where we're going and why we're going. And just to give you an idea of where we've gone so far. So we started this program about 2.5 years ago now, but it took probably 1.5 years to develop the program. But we were developing this program as if we didn't receive any funding. So fortunate we received funding, but then we had to pivot to be able to maximize that. And so to date now, we have approached Lake County, St. Joseph County, Elkhart, Allen County, Hamilton, Hendricks, Johnson, Grant, Vigo, Monroe, Clark, Harrison, Scott, Floyd, and Vanderburgh. And so I think that's about 14 or 15 counties. And we really just started this in the early spring of this year. So we've engaged like 16, 18 counties, and 4 of those communities have received planning grant and now implementation grant dollars. And 2 of the communities are actually implementing these grants out in their communities to work towards identifying service members, veterans, family members, caregivers, promoting connectedness, improving care transition, lethal means safety, and education. And then Obadiah is getting ready to come on here in just a moment. But once he's done, I'm going to get in a little bit more into some of the different priority groups and how we work towards identifying veterans in the communities and ways that we can work to partner with each other. And without further ado, I'll pass it over to my co-worker, Obadiah Smith.
I was told Obadiah had joined the call. Is he having technical issues? Does anybody know?
Okay, I'm unmuted. I'm in here. Can you hear
Oh,
me
here
now?
you. Yes.
Okay. All right then. And also what I'll do is and when I give a great pause, that means to move forth actually to the next slide. But
Okay.
thank you for the opportunity that I have to actually present before you, and really thank you and your coworkers for 211. You're all very instrumental as far as giving resources to those that are in the community. But as we talk about suicide intervention, first let me introduce myself. My name is Obadiah Smith. And I was very fortunate as far as entering the military at the age 39, almost 40, and completed actually 20 years. Previous experience was Joint Base McChord up in the state of Washington, Wright-Patterson Air Force Base there in Ohio, and then also finished my career in the reserves there at Grissom Air Reserve Base here in Indiana. And my last 5 years, I was actually called up for 5 years of active duty, and I retired as a light colonel, as a chaplain, and had an opportunity to serve my country well. But when we talk about suicide intervention, or even at the community level, when individuals actually hear the word suicide intervention, it really has a negative connotation for several reasons. Because there's a stigma around mental health issues. And if you're really one that's receiving suicide intervention and hearing the word suicide, it's very intrusive, as if there's something wrong with you as an individual. And also, it brings out a positive outcome if we look at it in the positive way, particularly if we can use proper methods of intervention. And with that, we're actually bringing forth intervention to complex problems or crisis or that an individual may be facing. Crisis intervention. It actually highlights the human aspect of intervention. It's give hope, empathy, and understanding that I believe is very essential to the long-term recovery and mental wellness of an individual. And when we frame crisis intervention as a compassionate and supportive process, it means that we're bringing forth a holistic approach that addresses not only the crisis, but also the emotional and psychological need of the individual. And the definition that I have here is that crisis intervention is not just about saving lives, it's about offering hope, empathy, understanding, and support to those in their darkest moments of their lives. And together, notice the word together, and together we can be a beacon of hope and light that guides individuals to healing, resilience, and well-being. Crisis intervention. And I give an example that there is help and there is hope, and that you can save a drowning swimmer from the water, but the swimmer still can drown. Now you must get the water out of them. And this is important because it emphasizes that crisis intervention goes beyond the immediate life-saving action. And when we look at the word krino, that comes from the Greek, it actually means that we need to distinguish and choose a decisive decision of how we're going to interact with someone who may be in crisis. And then the Latin word intervenire means that we need to come in between. So that therefore, when someone is actually going through a crisis, there's a decisive decision that needs to be made, that we need to come in between them, that we can say that there is help and also that there is hope. And when we come from this particular standpoint, it empowers the community to be more active in guiding individuals through their struggles and fostering resilience and promoting the overall well-being of the individual. And essentially, it's a call to action that reminds us that effective crisis intervention transforms lives, that we're in this all together. Well, what are some types of interventions? And I just want you to think about that. There are things that you may have implemented in your personal life as far as giving assistance to individuals, and particularly as 211 operators. I'm pretty sure that you've given a lot of intervention into individuals' lives. But think to yourself what you can give to others, and then also what type of intervention that you may have to go through as an individual. Direct services, that's professional support. Tough love, which is a difficult one to be involved in, particularly if you're really dealing with someone that you truly care about. And when we talk about preventative, it's actually having specific activities that and preventing something that may happen in an individual's life. Therapeutic is really a professional and treatment. Also, when we look at medical, it may be triage, or we're looking at a medical condition that we want to prevent, treat, or improve one's health. And then we have what we call community-based intervention, is actually implementing tactics to improve the well-being of the community. And recovery, as you know, is those that are experiencing some type of chronic substance abuse disorder, and that they may be facing something that's prevalent within their lives, and that someone needs to stand in the gap. But one that I believe is truly effective is peer-to-peer. And I can give you an example. About a month ago, we were in the nominee conference, and I was giving the crisis intervention briefing here. And an individual or a pastor from the church came up and actually said, I'm having difficulty making contact with an individual in our congregation who is a military member. And it seems that I just don't get it. And I just asked, well, can you put him on the phone that I can speak to him? And this is peer-to-peer now. And really, as a chaplain, I really had to dive down deep, maybe use some language that wasn't abusive, but mainly for the individual to have a better understanding. Because when we talk about understanding, to understand means to stand under. And we connected well. And then in the end, when I knew that he was in the congregation, as far as the Christian congregation, I kind of gave some scriptures and kind of actually had an opportunity to pray with this individual in order for them to get the help that they need. And that's peer-to-peer. And therefore, I want to encourage you. There are some things that maybe you have went through individually that you can really give certain advice to other individuals because of this. You've been there, and not only been there, but maybe you've been there before. Because sometimes getting there can't tell been there nothing. Crisis intervention. Actually, what we call it here, as far as that's prevalent in the state of Indiana, is really our crisis intervention teams. And really, this teams is a collaborative community-based program. And it's really reducing the stigma of mental illness. In other words, crisis intervention teams from the community base is to help individuals with mental illness by de-escalating situations that they may have as far as their interaction with law enforcement. Therefore, we're diverting the individuals, and that through CIT teams, you divert the individuals with mental illness away from the criminal justice system into a proper and appropriate treatment program that can help them. It creates a more effective interaction between the law enforcement and mental health care providers, and has also increased the safety of people with mental illness and their families. And really what I want to share with you right now is that sometimes we cannot disregard individuals with mental illness. Many years ago, I was a psychiatric case manager there in Pasadena and Los Angeles. And we had two psychiatric case managers, a psychiatric nurse, and a psychologist. And to the point that we would actually pick up mentally challenged individuals that were homeless off the street. And this particular story I'm going to share with you is actually a real story. And it was an individual by the name of Jody. And Jody had the demeanor of Dustin Hoffman in Rain Man. And I'm pretty sure many of you saw that movie. And the psychologists and the psychiatrists got around Jody and they asked her a question. And this is a true story. And I want to ask you that same question. They said, Jody, what is the difference between an airplane and a butterfly? And Jody pondered this question for 5 minutes. The 5 minutes turned into 15, 20, and almost an hour. And the testers and the examiners were ready to leave. And Jody stopped them and said these words, excuse me, the difference between an airplane and a butterfly is that an airplane cannot land on a flower. How powerful is that? And that came from someone that was mentally challenged. So therefore, your interaction with other individuals that are not like you, they are human beings too. And sometimes we cannot just judge the symptom, but we must look more deeply into the individual and what particular needs that they can have, that we can meet that need in order to make them whole. So therefore, when we look at Indiana, as I said earlier, the crisis intervention teams is a pathway to recovery from the mental challenge. The program unites community leaders with a common goal to keep individuals with mental illness out of jail and on the path to recovery through proper treatment. And when we focus on the diversion of understanding this, the program not only reduces the arrests for those that have mental illness challenges, but also significantly increase the chances of the individuals to receive the proper care that they need. Well, here in the state of Indiana, the following map indicates crisis intervention teams in Indiana. The yellow highlights the 4 counties that are interested in CIT teams. The orange has 4 counties that are planning phase for the future of CIT teams. And the green indicates the 29 counties that actually literally have crisis intervention teams in their county. The following 3 counties listed here are foreseeable counties that's in and through the governor's challenge, where hopefully that we're moving forward to indicating that those counties are paramount in reaching veterans and others with mental health challenges in their community. And the QR code here, if you want particular more information to learn more about crisis intervention teams through NAMNE, therefore you can use this QR code. You'll understand how it works, how the communities come together, and additional prevalent information that you would want to understand what crisis intervention teams are here in the state of Indiana.
I think
now, when we look at crisis intercept mapping, it's community-based also, but its particular emphasis is on for our service members, veterans, and their families and their caregivers. And the objective here is to assess and improve the community crisis care system and services for veterans. And therefore is strengthening the partnership between the military and the civilian community and the stakeholders. And the overall goal is to develop a tailored crisis intercept map for the community. And the initiative is to seek established interagency protocols that's coordinated with individuals from the community that they put in best practices for suicide intervention for the service member, the veterans, caregivers, and their families. And some of the major objectives is to strengthen partnerships that can come into relational connectivity, develop a tailored crisis map or program, and then the interagency protocols, and to implement the best practices as far as suicide prevention and crisis intervention in the community for the military member and their families. And the overall emphasis is that it enhances community care, it builds strong partnerships, it's crafting a customized crisis interceptive plan, it's establishing coordination and protocols, and it's implementing the best practices as far as suicide prevention. And let me kind of share a story about an individual who was in the military. And this is a true story too. This individual had an opportunity, was on active duty for about 5 to 6 years, and actually would come home on the weekend, on a Friday, and go back to the base as far as on Monday. And this individual noticed that every time that they went home, and when they entered their home, the dog would respond to them by having accidents all over the house. And this individual became a little worried about that. And they went back to the base and actually shared with their crisis team there at the base in which they were on. And they shared and kind of took it out of context or within context by laughing and saying, every time I go home, my dog is having accidents in my home. And when they shared that, the clinical social worker returned to the individual and asked them a question. And they said, Colonel, is it the dog or is it you? And personally, I had to ponder that question because it was me. And so therefore, when you're working and interacting with the military personnel, you have to understand there's a military culture, but also there's a civilian culture. And how can those two things come together to bring balance in an individual's life? Because we as military, and some of you all have been in the military too, that is a difficult transition of balancing both lives and culture as far as how they relate to one another and how they relate to your loved ones, your pets in your own home. So it's prevalent that you truly understand that the crisis intercept mapping to the military community is paramount so that we can really understand what it means to have resiliency and relocation of coming back into our community. The crisis intercept mapping, as far as that's here in the state of Indiana, is actually with these particular communities that they have been implementing as far as St. Joseph County, Hamilton County, and Johnson County. Now, crisis intercept mapping also looks at and really looks at some broader situations that are crisis intervention. And I'm pretty sure many of you are very well aware of these particular agencies that are operational here in Indiana. And I know that you know 988, and that's really a short number, but has an overall significant impact of connections to those that are calling in to receive information as far as the resources that are available. When we look at MIRS, it's mainly a peer-to-peer that actually has national statistics as far as opioid overall fatalities. And within the state of Indiana and across the US, it actually has said that the opioid overdose fatality rate has dropped nationwide in 3 years, and that this is a significant drop because of things being implemented by MIRS. When we look at MIH, it's mainly a focused on inpatient care that is really home-based, that individuals will come out to their home to give them the crisis care and the care that they would need that's tailored to the individual individually. And then we have Alt 2 suicide. It's really it's not a clinical response, but it's peer-to-peer support groups that have proven to be effective as far as individuals who have faced suicide or contemplated suicide, that they can really sit down in a group or individually to give some guidance and some help to an individual. And really, I want to really give more information on Alt 2 suicide that's actually done through FSSA and DMHA. in which I am in partnership with, as Brian mentioned earlier. I have 2 offices. I have an office here at IDVA, and I also have an office down in DMHA. And like I said, Alt to Suicide is peer-to-peer. And I can actually say that we're actually implementing this within the prison system, because many of your incarcerated individuals are veterans. And not only are they veterans, but they are going through crisis as far as being in the military with PTSD, and now trying to acclimate to the prison. And I worked as a prison chaplain for several years here in Indiana, the Pendleton Correctional Facility, and I really saw this firsthand. And let me tell you, the penal system or the prison system is a different society. Their culture and the things that they value on the outside, we will call it insignificant, but it's significant for those that are being incarcerated. So Alt to Suicide is something that's very important as far as sitting down with individuals, peer-to-peer, that even incarcerated ones may have contemplated, thought about suicide, but yet there's some intervention skills that can be done through alternatives to suicide. These are the counties within the state of Indiana, the following 12 counties that have implemented alternatives to suicide in the state of Indiana. And then lastly, here's my information that you may have as far as contacting me if you have any further questions as far as about suicide intervention. And then I want to end with this particular quote that's been a model for my life by MLK, that we are caught up in an inescapable network of mutuality that is tied in the single garment of destiny. And whatever affects one directly, sooner or later will affect all of us indirectly. Therefore, when we say community, and community for me is this, is living with those whom I least likely would like to live with. And if your community looks like you, smells like you, acts like you, then I question if it's true community, because we live in a global environment, and the things that we can bring to that environment is resources that can elevate itself as far as actually giving help to those who truly need that help. I want to thank you for the opportunity that I had to share with you, and I wish you all well as you continue to reach the disenfranchised and those in the community in and through 211.
Awesome. Thank you, Obadiah. And so I want to be respectful and be able to answer some questions if need be. So I know our time's getting short, but I'm just going to highlight a couple more slides real quick. So you heard me mention about the 3 different priority groups. So really that's our focus, is we want to identify service members, veterans, family members, caregivers, screen for suicide risk, promote connectedness and improve care transition, and then lethal means safety, education and safety planning. Next slide, please. So how are we working towards identifying veterans? You know, we're using something simple, which is a QR code. This is something that we can work and partner with each and every one of you. For instance, we work with, I think it's a cancer center up in Northern Indiana. You would think that we're just looking to find veterans, but what we do with them is we provide them with a unique QR code for each of their cancer centers. And so what happens is they post the QR code up. Are you a veteran? Have you served? Has a family member served? Scan here. And then that first message is unique. So that first message could be a 211 link to event calendar, or the family resources within the event calendar, whatever it is that you want to highlight from your specific point of contact with that individual. And then 2 days later, we connect with that veteran, service member, family, caregiver with, are you a veteran? Have you served? Has a family member served? Scan here. Then we find out their branch of service, dates of service, and ultimately connect them to the county veteran service officer within their community to get them filed for service-connected disability benefits, or the tuition and fee exempt, or the property tax deduction you heard me speak about. earlier. And so again, this could be a curated message that could be utilized however you best see fit. Next slide, please. And I'm actually going to go ahead and pass this slide as well. I just want to get to the question part. Then coming up, we have a federal Department of Justice grant that we applied for called the Burn Skip. That's Crisis Intervention Program, State Crisis Intervention Program. And so we actually received this grant, but it's not necessarily a veteran grant. It's a community grant. So we'll be looking to fund vet courts, the creation of crisis intervention teams. We could work with law enforcement for things such as body cams and different things like that. So there's a whole host of information that we'll be starting to distribute out through our network in the coming months as once we have the dollars to start granting out. So we'll ensure that this is something that comes across your all's desk. Next slide, please. And yeah, this is back to the identification. This is just an example of how that kind of curated text message stream looks. This is the message that we follow up 2 days after we would put up your own unique QR code message. And just to give you an idea of a unique message that we do, so Ball State University does this now. So the individual that does the Montgomery GI Bill for the veterans has literally 2 minutes to go up in there along with like 30 people that are presenting. And he puts the QR code up because the great thing is, yeah, you might have a veteran that's in the crowd that's going to scan it, that's going to find about more benefits or resources available to them, but probably using the Montgomery GI Bill. What's great about that is we could have a child of a veteran that's starting school there, and maybe their parents are paying the bill, or maybe the kid took out the student loan debt to pay for that semester of college. Well, by that next semester, we could probably get the parent of that veteran connected to the county service officer, find out they're eligible for a service-connected disability rating, and that student is then going to college tuition fee exempt. So a lot of benefits. The best way to uncover what's most valuable to certain industries or industries, organizations, agencies is to work with them and collaborate like we're here doing today to uncover those opportunities. Next slide, please. And yeah, that's it for me. I think I'm leaving. I'd love to have some more time for some questions, but it leaves us about 5 minutes. Love to join in, do some QR code work for you, or to expand the conversation as however you best see fit. Again, thank you for your time and look forward to answering some questions.
Sherry, are there any questions in the chat?
There are, yes. So we have a question that says, at our food pantry, we interact with our neighbors monthly and over 100 neighbors visit us. Is there a flyer or some resource that we can distribute to our veterans?
Yeah, absolutely. That QR code would be the main thing. It could be, it would be a unique QR code to your place, but them simply scanning on that and then the kind of stream that triages the things that are most relevant to them. That would be the best step. Outside of that, we can work further with some different printed materials or things like that. But the ultimate connector to resources for veterans is that local county veteran service officer. On our website at IDVA, front and center on our webpage, there's a thing called Find Your CVSO, County Veteran Service Officer. And it has the phone number, office hours, email address of that one. There's one in every single county. That would be a great individual to maybe have on hand at some of those. I mean, they're not going to be able to attend all of them, but that's a great resource to have to collaborate with, for them to promote that service to some of the veterans that come through their office. So yeah, it would be the QR code and the connection to the county veteran service officer. And then not to mention, we could also highlight something like that event on our event calendar as well, and then promote that food pantry further through the veterans that live within that county or zip code that are already in our text stream.
All right. And then another question that we have, as far as the veterans benefits for the housing information outside of the VA loan, do we have them contact their VA locally? A lot don't know all the resources that are available to them.
Yeah. So, housing is, that with a lot of the different nonprofits, like in Marion County, we think of the HVAF, helping veterans and families. Every county is different. And again, that kind of goes right back to that county veteran service officer that would know those local resources. in relation to housing, like the Lafayette has the Lafayette transitional housing. But we could actually, through our office, we could connect to them or the county veteran service officer. Outside of that, we have a partner on our Governor's Challenge team, the Indiana Housing and Community Development Association, that would also be aware of that or those services.
Okay. And then our next question is, when working with veterans experiencing mental health challenges, is there different verbiage or ways we should support them on a call versus civilians experiencing mental health challenges?
Yeah. So military culture training is something that's quite relevant in that conversation. Through partners and people we work with, and I consider you all our partner now, and I hope you consider us one also. We have a licenses through what's called Psych Armor, PSYCHARMOR. That's something that we could work to with your guys' leadership to distribute to everybody. So this is free online training, and there's military culture training, exactly what you're referring to, that we could give you the kind of free logins to get on and take that and utilize within your own partner agencies or all of you collectively. That's something that we could provide, that you could get on there, pop in there and take those trainings and other trainings such as VA SAFE training and caregiver training and everything across the board.
All right, thank you. And then we do have a question about someone asking if the PowerPoint slides will be available after the session. If you want to email the Indiana 211 Community Engagement Team, and I'll put our email in the chat here, anyone who wants those slides directly, we'd be happy to provide those. Just send us an email.
And then you'll see Obadiah's contact information, about two-thirds of the way through that, and mine at the end. So yeah, get a hold of us.
And
All
I'm going
right.
to share some information at the end with the IDVA website, and that's where you can go to find those community. Is it CVSO?
The
that you were-
CVSO, the County Veteran Service Officer.
Okay. But just really quickly, because I know we're almost out of time. If you go to the in211.org page, I'll show you what kind of search you can do for military and veteran resources. However, if a person calls Indiana 211, they will be asked by the call navigator during the initial demographic questions if they or anyone in their household have served in the military, and that does help them find additional veteran resources. Here are the types of resources that we can help with at Indiana 211. Anything from housing and rental assistance to financial assistance, holiday assistance, child care warming centers for those unhoused, soup kitchens and food pantries, substance use disorder treatment, support groups and counseling, information helplines, and case management. And you may have seen the first slide I had up. Obviously, I think if a person is indicating self-harm or harm to others, you want to get 911 involved for everyone's safety. But if they are experiencing a crisis or maybe a substance use crisis, you can call 988. It is confidential. I know that's something that I think many of our veterans especially are maybe concerned about, the confidentiality of things. It is confidential, and so is Indiana 211. And you can call Indiana 211 for resources and information as well. If the call navigator detects that the caller may be in a crisis, they will be able to do a warm transfer to 988 to help that person.
Awesome.
Real quick, you can go to indiana211.org anytime, or in211.org anytime, and use search words such as veteran, military, soldier, service member family, and then type in a zip code and click search, and it will bring up various resources. Soon we will have a button on our guided search page that is specific to veterans and military family members.
Amazing.
And this just is an indication of what it would look like when you get to a page after you've done the guided search. Some upcoming topics. Well, what did I do with our page? I had a page with your information. I apologize. I think it's IN or IDVA. What is your webpage?
in.gov/DVA.
Okay. And then from there, it will take you to the various resources and information that Brian and Obadiah spoke about. These are our upcoming topics. And I think before we hang up, if you guys, I know Sherry put up several QR codes and information in the chat, the link to the survey, as well as some of the ones that Brian and Obadiah had mentioned. So I want to thank you all so much for this. What an excellent presentation. And again, I'm sure we all feel the same way. Our veterans are so important to us and our military families. So I want to do whatever I can to help them. So I hope that you all benefited from this, and I thank you very much for presenting today.
Yeah, thank you. Maybe we can come back in May for Memorial Day.
That'd be great. That'd be great. So,
And I do see that there are some questions that we did not get to, and there are some questions about how to access this information. If you have any questions that did not get answered, or you didn't catch Brian or Obadiah's contact information, feel free to send us an email at 211, and we would be happy to pass that along to you and get you connected to them.
Absolutely.
thank you, Sherry. That's great. Thank you for joining us today, everyone. Again, this will be recorded and on YouTube at some point if you need a chance to go back and watch it or you missed part of it. And I think with that, we'll end our session.
All right.
Thank you.
Thank you.
Thank you all.
Thank you.